Okay, good evening, Stuttgart military community. My name is Colonel Jason Condrey. I'm your Garrison Commander, and I want to start by, first of all, thanking everybody for tuning in tonight and for your questions that came in advance. I'll begin with a COVID update and some opening remarks designed to answer a lot of the questions that have either come as part of this event or have come into the Garrison Assistance mailbox. And then we'll get to some of the questions that pop up during this live stream. First, I want to offer a shout out to fellow white group members. I know I'm not supposed to pick favorites, but so for COVID, I will tell you that the combination of individual actions, the things that units have put in place, and of course what we have as a community have done to halt the spread of this virus has had an impact. You've heard me say this is an adversary we can't see, and I'm pleased to say that today marks 7 days since we had our last positive case reported, and so that's a testament to the efforts of everybody out there, and I hope for that trend to continue, and I think what that means is, with those kind of results, our recovery and return to work rates will continue to outpace infection. We're ahead of the virus. I want to stay ahead of the virus. Of course, that doesn't change the face of the threat. And it's faces that we see every day. It's the asymptomatic and pre-symptomatic people that are smiling. And just the smallest misstep may be the difference between the virus being passed from one person that doesn't know they have it to another. And so the only way you can protect from that smiling face is by sustaining the things that we've put in place. It's the hand washing, it's the individual hygiene, the cloth facial coverings that I see everybody wearing. It's the things that we've done in our workspaces, the alternate work schedules, the telework, the deliberate rotation of who's in the office, who's at home, and the things that we're doing to keep services clean in those workplaces. And it's the things that we've done with respect to our services by deliberately dividing up how the community interacts in those places that have the biggest chance for the virus to spread. And so I know there's still more questions than there are answers about the virus. I don't know how long it's going to be a central aspect of how we interact, of how we work together, of how we adapt our missions, and how long it'll affect the way we do things that were part of normal life. I don't know when we're going to get back to what we consider to be normal, or how what will be new to us and soon to be considered normal. I will tell you that even with the great results that we've had over the past 2 weeks, that I'm still working to ensure that the services that I'm responsible for providing this community remain resilient. Because I know that phone call can come at 10 o'clock at night or 6 o'clock in the morning, and one positive result can take out the individual that would be coming to work, and potentially 4 to 5 coworkers that have had sustained contact with that individual. And so I'm concerned about that. That reality is a phone call away. It's one test result away. And so the measures we have in place, they're working, and I'm not willing to throw those out. They'll only continue to work if we maintain some discipline. We remain vigilant. We settle in and understand that in order for us to have these kind of results, we're going to have to remain in front of the virus. We have to do things that keep us in front of the virus. The other part of that is, we've got to make sure we don't get ahead of our German partners. They are equally concerned about complacency and resurgence of the virus, and they're focused on protecting all the members of the community. I get calls from leaders all the time that are focused on how we're doing here and if they can assist. This week they began to reopen some businesses and services, but they're doing it very deliberately. They're doing it in a manner that allows them to protect against the spread of the virus. So they'll still keep social distancing. And then starting next Monday, you will see that they go to a mandatory requirement to wear cloth facial coverings out in public. to wear them on public transport, when you're out shopping, when you're at public spaces, when you can't maintain that 1.5 meters of distance that like us, they've identified as key to keeping the virus from spreading. Hairdressers and barbershops, they've talked about beginning to reopen those on the 4th of May. And that's presuming that those businesses can put in the right protocols, the right measures to ensure that the virus doesn't spread, because there's no way that you can, cut hair, style hair without there being, close and sustained contact. And during that time, the virus would have an opportunity to spread. And so I know everybody here is interested in us here on the installation doing the same. And I will tell you that as we watch how they do it, and we implement the same kind of measures that you expect, again, to ensure that the virus doesn't spread, we'll provide you the information on how and when we do that as soon as I have the information to offer. Still many questions about events. I know there was a lot of broken hearts because yesterday the leadership down in Bavaria announced that they had canceled Oktoberfest. And so I think we can presume that the Cannstatter Wassen will be canceled here as well. All other events definitely being canceled out through August 31st. And so that has a lot of implications on things that we do here, whether we're talking about graduation, whether we're talking about 4th of July. So we're exploring options as to how we can continue to do those things that are part of the fabric of this community, and how we do them in a way that is memorable and does that event service, does that occasion the right justice. A lot of people are concerned about church services. How and when do we get back to something that is more normal? How do we do communion? And so I know that's something that our partners have talked about. Outside the way I've talked about keeping those gatherings at a minimum. So how do we continue to do virtual services yet work through some of the other sacraments depending on the religion? And so I want to make sure we're aligned with our host nation partners. I want to make sure that we continue to meet the agreements that we have an obligation to meet, and that we can say with certainty that we are not part of the problem, that we, if anything, are shouldering more than our share of a task when it comes to preventing the spread of the virus. Schools, lots of questions about schools. I know that starting on the 4th of May, some German schools will start bringing in students again. They're going to do it in a very deliberate manner, keeping kids spread out, preparing for the Abitur exams, preparing 4th graders for their exams to get them into secondary school. But there is a very deliberate process that they're going to go through with that. I don't know when there's going to be a decision on Dodea schools. We've got 7 weeks of school left, and we'll see when that happens. As soon as I know, I will share that with the community. I know Dodea will keep the community abreast, and we'll make sure that we echo those any announcements that come from them. Fitness. I know people are tired of Zombie Land Rule 1. It's got to be more than cardio. There's got to be more than body weight exercises. The things you're trying to do with YouTube and other programs out there. People want to get back in the gyms. I get that. Right now, again, pacing off our German partners, the only people they've let back into their gyms are their professional athletes. And it's a very controlled atmosphere where hygiene and preventing the spread of the virus is central to what they're doing, as important as the training that those professionals are doing. So we're looking at some options as to how we do things with outdoor fitness. Given the difficulties with keeping things indoors and the potential for the virus to spread very easily from machines or contact with free weights, all of those things we're trying to figure out how we can do those. But the first caveat has to be that we must have the measures in place to protect from the spread of the virus. And so that's going to be a driving factor in all elements of fitness. So this is round 2 of red, white, and blue. Things are going fairly well. I think as additional groups come in, you see how the associates at AFES and the commissary and the Garrison, we've learned how to do things better, and as you come back into those, you can see where the improvements have been made, and hopefully some of the frustrations you had with the first round aren't as present. And it creates opportunities for you to highlight, once again, where we might be able to do something a little bit better, and we welcome that. We've got more staff back, and so some of the things that we had initially closed are reopening. Whether we're talking about car care service, dry cleaning, alterations, some of those things that we're going to try and you'll see them open in the same way we have other services open, whether it's by appointment only or individual engagements. The same kind of standards with respect to only this many people can be inside at any given time, so that we ensure that we are maintaining the physical distancing. Also, to offset some of the inconveniences, both the commissary and soon, starting with Blue Group, AFES will offer a curbside delivery service, and I will tell you that's not been possible, at least from the commissary's perspective, without our volunteer coordinator and those of you within the community that have been willing to do that shopping and carry out to a car. And I will tell you that the intent behind those programs is for those high-risk families that are concerned about coming into those community spaces. And those people that can't come into the store at all. So, white group, you can go in and shop at the commissaries. I'm expecting to see, red or blue group be the ones that are utilizing this curbside pickup, perhaps to get that, that ingredient that allows you to finish the birthday cake or something like that that's important to the family. Those are the things that you identified early, and we worked quickly to put additional measures in place. It's all about making sure we've got those layers of defense and that separation within the community that prevents the spread. And so I'm asking for your support and your continued assistance in making sure that how we do that as a community continues to meet that end. AFES continues to provide a fantastic school lunch program. My kids love it. I like it when they don't finish their lunch. And adults, if you wanted to buy a meal, you can do the a la carte program. So if you haven't checked out that program, I think it is incredible. Some great food, and yet another takeout program that you might not have considered just yet. The mail pilot continues to draw more participants. I know that we have seen a reduction in the amount of mail that is delivered here to Germany. Some of that is a function of supply chains back in the States. Some of it is the number of function of the aircraft that are flying across the Atlantic. But right now, as that being the one service that I can't find a way to replicate off the installation, I'm going to continue to keep the measures in place that protect it. And so I appreciate the patience that goes along with using red, white, and blue in order to get mail and get some of those things that you've been waiting for quite a while. Lots of questions about PCS season and the recent announcement and signed document by the Secretary of Defense that delays or extends the stop movement until the end of June. I will tell you that unless we're talking with mission partners, we're trying to identify members of the community that are exempted from that decision. And then, of course, there's the exceptions, and then how do we prioritize those exceptions in time and space? And I will tell you, one of the major considerations we're looking at is where families are going to next. Do they have school-age kids that need to be in a certain location before school starts? People are traveling with pets. Do we have enough capacity to transport pets? There's lots of things that are part of the PCS process that the government, that the Garrison doesn't own, and in some cases even the government doesn't own. We can't control commercial air travel. We can only request that those moving companies that move us in and out of our homes have enough crews, have enough trucks, have enough truck drivers, have enough warehouse space to transport and move all the stuff that we need to move. And so there's lots of questions out there, and I know that for those that are scheduled to move this summer, both out of the community and into the community, there's a lot of concern, and we're working through the planning and hope to have a lot of those questions answered as soon as possible. We're going to continue to look for ways to open additional services. I continue to be convinced that what we do here within the community is going to be the safest option. It's going to mitigate the risk of the virus, in a consistent and persistent way. And so, from that perspective, I want to make sure that when we open things up, that we've met those conditions, met the community's expectations. And so, I want to make sure that everyone understands that there are lots of things you've asked. We're continuing to look at those. We'll continue to provide updates. I will get to some of the questions that you sent in advance. And so I'll kind of go down the list here. So this question came from Ryan. Are commands looking at reducing telework and returning to full staffing at work? So Ryan, the short answer is yes. I will tell you that we had a shortage of space, not just parking spaces, but inside of our work areas. And so as commands are looking to do that, they're trying to figure out how they do that in a way that ensures that the virus doesn't spread. The virus isn't transmitted at work. So that's first and foremost, and they're going to be very deliberate about how they do that, so that they've done something that contributes to spread, that they can quickly dial it back. And each unit, each mission partner is approaching that a little bit differently, except for the fact that they're all focused on how we don't reverse the gains this community has made when it comes to bringing back into work. This question came from Jessica. So can you clarify the travel restrictions within the local area? The Bad Urich waterfalls, for example. I would like to travel to some different trails to hike with my family, but when referring to General Order 1 Alpha, I am unclear on if that's okay. So if you're traveling within the local area and you are not violating the German ordinances with respect to just being with your family, not having more than two gathering together if you are not part of a family, and going to a public area using that, it's not not a significant amount of travel, then you're not in violation of General Order 1 Alpha. You're not in violation of the of the German policies that are in place that General Order 1 Alpha is framed off of. The challenge, I think, is going to be finding those hidden gems of spots where 30 other families haven't had the same great idea. And so, Jessica, as you find those locations, and it doesn't require, what Germans would consider to be tourist travel, because you're not going to be able to get a hotel. You're not going to be able to get rent a home. So it's really going to be the day trip type events, and the desire is that you stay as close to home as possible, both from a German perspective and then from our perspective as well. This question's on medical from Sarah. So it's about the dental clinic. Will the dental clinic reopen for procedures, non-emergency and cleanings that were scheduled before the closure? Actually, it says not cleanings, but so right now, feedback from the clinic staff is that don't anticipate being able to return to a routine dental procedures until the end of May. And they're going to look for a way to accommodate those patients that had to have their appointments canceled. So more to follow on that. I know there may be a question about whether or not dependents will still be available. At the time before we closed, we had the ability to support dependents. I think that will be on a case by case or as services are available basis. So more to follow on that. This question came from Julie. So as we're already about halfway through the spring CYS sports season, doesn't appear that things will change in time for them to start. Will registration fees be refunded? And if so, when and how? And so spring sports have been canceled. Those funds for those specific sports programs have been refunded to a family account. And so the hopes are that they could be applied toward future sports programs when we have the conditions set to reopen them. But if you're departing or if you want your money back, there is a way if you contact Latoya Hambright, she'll be the one that can help make sure that that your funds are refunded. Natasha's asking, will the daycare reopen soon? So daycare for mission essential functions is one of the things that our German partners highlighted in their their gradual reduction of COVID limitations. And so we've started the conversation. I'm still not exactly sure how we will do that, simply because our kids, no matter how much time we spend trying to keep them apart and keep them from bouncing into each other, we're not going to be able to achieve the social distancing and the protection from the virus that's necessary. So that's going to be a high risk service, and I think it's going to be one of the ones that we open up later than many of the others. And I think we're going to be dependent upon a better understanding of the virus and how we might be able to identify it earlier. So short answer is we're looking at it. I don't know that we have the right answer just yet. And then with that, there's going to be a need to reprioritize who is considered mission critical, mission essential, depending on how organizations have arranged for work. And so there's lots of considerations there. Want to make sure we're taking care of our kids. Want to make sure that we're taking care of the care providers, and then of course all of that is in support of the missions of the organizations here on the installation. Heather was wondering if there's any talk about opening arts and crafts. She makes masks and is looking for the materials to do that, whether it's elastic or fabric. And so I've already seen a proposal from our MWR team about opening that back up. It comes back to making sure that we're not out in front of our partners, who have similar type stores, and that we have the right measures in place that allow us to do that, to open up that store in the same manner that you're seeing everywhere else with our services. So I'm hoping to have some news regarding arts and crafts specifically. I know woodworking kind of falls into the same category. So those are the kind of questions that there are lots of people in the community that are interested in knowing the answer to, and as soon as I have more information, I'll be sure to share that with you. I got a question here from Bonnie on the stop move, and it's, can we get better clarification on the travel ban? Can military dependents travel back to the States to visit families? So the directive that came from the Secretary of Defense applies to service members and civilians that work for the Department of Defense. So technically it doesn't apply to family members, but there are lots of other things that will apply to family members as they travel back. I don't know what the quarantine requirements will look like. I don't know if there'll be enough commercial aircraft that'll support travel in the time frame that you're looking for. So there's some variables out there that are worth considering, even if the stop move directive may not affect you as a spouse or the children of a service member or civilian. Okay, I think the other ones I hit. There was a question here about WIC, and so this is somebody that sent this question in based upon supporting a quarantine family that uses WIC and uses them in the commissary. So what I know is that there is a method to have somebody do the right paperwork to ensure that somebody else can use those certificates on behalf of the family. I'd ask that you reach out to the Garrison Assistance Team. We can put whoever that is in contact directly with the experts on that, get the right paperwork so that there's not somebody that goes to the commissary and finds out at the cash register that this isn't going to work. I want to make sure that we do that the right way from the very beginning. So if you've got the specific details, and I think the question came in without a name, please shoot that note to us directly. Those are the kind of one-eaches that we designed the Garrison Assistance Team inbox specifically for. So want to be able to make sure that we do that and get it done as soon as possible. Okay, what other questions are out there?
So you have a few questions coming in, sir, about the Patch Arts and Crafts Centre and whether
Okay.
this is going to be opening up soon.
So again, I'm hopeful that we'll be able to open that soon. That's one of the ones that I've got the staff looking at what measures we would need to have in place. Again, I'm looking for those same type of businesses that are opening up outside the installation. I believe the square footage allows us to do that. And again, it's making sure that we've set the conditions properly, and that the moment I open the doors, that we have got the right measures in place that prevent the spread of the virus. So I don't have a date for you right now, but I'm hopeful that in the next in the next 2 weeks or so that I have some great news for you.
And I'm sure some other people are hoping for some great news about the golf course reopening. Kerry asked that question.
Yeah, Carrie, that's a great question. Yeah, that's one of those ones where, as we pace off of our counterparts, whether we're talking about the Galaxy Bowling Center, whether we're talking about our golf course, and I have no doubts that we could implement measures that would allow us to physical distance, and keep things sanitized. But we're going to have to pace off our German partners with that. I can't have us opening up those facilities until similar things are opening up off the economy or out in the economy. So I hope to know more soon. I know that there are efforts with local business leaders out in the Stuttgart metropolitan area to do just that. And so as they continue to work with their political leadership, we'll be paying close attention so that we can do the same things for our community.
And this question is in that vein. As the German economy is reopening small shops, will General Order 1A Section 2B be updated to reflect local changes? As currently written, the order excludes us from going to any shops not defined as life-sustaining. So
we've got the legal team already looking at General Order 1 Alpha to see how it needs to evolve with how our German partners are evolving. The intent is that order mirrors the guidance that's coming from the local community. And it serves as our reassurance to our partners that we take our commitment to that agreement and enforcing the measures that they put in place very seriously. So we will lag in doing things like that, just because I want to make sure that we don't inadvertently loosen a limitation that shouldn't be loosened. But right now we're looking at that, and we'll hopefully update the orders that control our actions both on the installation and off.
Chris asks, can we stop closing off so many gas pumps at the shopette? I understand social distancing, but it seems excessive.
Chris, I know one of the reasons why we did that was to ensure that we didn't exceed the number of people that we wanted inside the expresses at any given time, and I know that there are peak times when that looks different than others. So I'll continue to default to our AFES general manager in terms of what's the sweet spot, whether we need to open a couple others up. Because the last thing I want to do is create a requirement that people are now queuing outside of the express. And so if you're going to be in a line, I'd rather you be sitting in your car, on your smartphone, waiting for the next opportunity to come up to the pump than trying to maintain 6 feet of social distancing as you wait for the hand washing station outside of the express. And so that's one of those, given how small those facilities are, kind of what's the lesser of evils there. So more to follow on that. And we'll see.
We haven't seen this article, but Federer has asked, will DoD personnel be issued masks, according to the Stars and Stripes yesterday? There's an article that mentions that. So,
Federer, there is now a production source through DLA, the Defense Logistics Agency, to receive masks. We know what the process is to order them. What I don't know is how long it will take them to get here. Most service members, there is a way to use issued equipment to do that cloth facial covering. and we will continue to look for ways to do that with all of our, with our civilian employees as well, both appropriated and non-appropriated fund, and our local national employees. And so I think there will be a lag in terms of how long it takes us to receive those. And so we'll have to find a way to continue to use the home aid or the issue item, methods to continue to maintain that cloth facial covering. And I do believe that will be one of the things that persists for quite a while, just because that represents your ability to protect yourself and potentially protect others from you, given how what we currently know about the virus. And that highlights another point. We have members of our community that can't wear a mask. Obviously, kids 2 and under, we can't put a mask on them. But we also have others, adults within the community that don't have, based upon their doctor's guidance, aren't wearing masks. And so those are some of the same people that are trying to minimize their contact during this time, because don't quite know how the virus is gonna react to them. But I will tell you that as you look left and right, as you look around our community, there aren't many people out there that don't care, that are out there not wearing a mask because they're trying to infect others. I said from the very beginning that putting that cloth facial covering on was a visible symbol that you own, your individual piece of preventing the spread of the virus. I still believe that's true. I just want to make sure that people understand that there are some out there that can't do that. And it's worth having that thought, considering that before the dirty look is thrown or the Facebook comment goes awry. So I just wanted to offer that based upon some of the people that I've talked to as well.
So the last question, sir, has been asked several times by Mikel Santiago. He's really keen to get this information out. What Garrison conversations are occurring with regards to a potential second wave or outbreak later this year?
So, Miguel, I think that the measures that we have in place are designed to prevent against that second wave. I mean, I know what our community's curve looks like. I know that it's different than the 17 others for the local community around us, the mayors that I talk to, the counties, the city of Stuttgart. And then, of course, when you look at all the different places around us, whether here in Europe, whether we're talking about the states where service members and civilians from across the country will come from here, those are all things that are part of the consideration, part of the conversation. And whether or not you're following the news and you think there's going to be a kind of an ebb during the summer and it'll pick up again in the fall and winter, I will tell you that your magic 8 ball is no better than mine. What we need to do is put the measures in place that continue to protect the community, and understand that unlike when this started, we now understand enough about the virus and how to prevent it from spreading. And so that if we take a step too far and we've allowed the virus to regain some of the ground that we've taken from it, that we put back some of those measures in place, that we're willing as a community to take a step back. And so I know that's the leading headline is, what do we do about the second wave? I'll tell you that what we're doing right now is what we do about the second wave. It's discipline, it's vigilance, it's not being complacent, it's holding yourself accountable, making sure that people are doing the right things, taking that extra step, washing your hands, being deliberate about cleaning surfaces that lots of people touch, light switches, doorknobs, that coffee pot in the workspace. All of those things that you didn't consider 4 months ago now needs to be part of everyday consideration. And so, great questions, lots of great questions, and I will tell you that the learning that the Garrison team and all the people that provide services across the installation have done has been because of some of the constructive recommendations, some of the criticisms that have come from members of the community out there. So I appreciate that. I know that the summer move and when that's happening and how it's going to happen, and I've got orders that say this. Are those orders going to remain? Every one of those questions is an individual question, and we're going to put processes in place that allow us to address every one of those considerations individually, because I believe that's what they deserve. I want to say thanks to all the volunteers out there. I mean, this is the the Volunteer Appreciation Month, and I mean, volunteers have risen to the occasion and exceeded all expectations out there. So thank you to those that volunteer. If you see someone volunteering and they've helped you, go out of your way to say thanks. They're doing it because they want to contribute. This is the month of the military child, and I will tell you that as I look at my own kids and as I look at kids that don't seem to be affected by this, I'm constantly amazed at how resilient our children are. Within being associated with the military community, already breeds some of that into them, and they seem to be rolling with the COVID punches, and so they the things that they are doing, I know there's some frustrations out there, whether you're a homeschool teacher or they're tired of not being able to go hang out with their friends, but the kids are doing a fantastic job out there, and we've got here we are in Europe, not able to travel as much as we would like, but we've got history all around us. I know right now that UCOM has got their historian is putting together a featured special on on the 75th anniversary of the end of World War II, and today marks the 75th anniversary of when the 100th Infantry Division stepped into Stuttgart, and so a pretty momentous day in terms of the Army being in Stuttgart, U.S. forces being in Stuttgart, and so check that out. I'll tell you that's worth spending some time, and in some cases we do have a little bit more time on your hands. I want to say thanks for joining tonight. I appreciate your attention. Please let me know what we can do better. I'm interested in improving every day if we can. Help me keep the community ahead of the virus. You've heard me say from the beginning that we're not going to let the virus set the terms. I believe that's what we've done. Every day's COVID day until it's not. I believe that. We'll continue to set the terms, but I can't do that by myself. I need everybody out there to be part of that solution. And if there's a better way, I want to know what that better way is, and we'll do it. So thanks. I appreciate your attendance. Have a great night.